What is scabies? Scabies is caused by a tiny parasite called the human itch mite, which burrows into the skin to feed and lay eggs. This can lead to an itchy rash resembling pimples, triggered by an allergic reaction to the mites, their eggs, and waste. The good news is that scabies is treatable. Treatment typically involves both topical remedies and, in severe cases, oral medication. Since these medications require a prescription, it's important to consult a healthcare provider for proper treatment. Once treatment begins and the mites are eradicated, itching and rash symptoms usually improve within a few weeks. Signs and symptoms of scabies. Scabies often causes severe itching, especially at night, which can be so intense that it disrupts sleep. This itching is usually the first and most common symptom of scabies. While scabies can affect any part of the body, certain areas are more commonly affected. These include the hands, particularly between the fingers and around the nails, as well as the armpits, elbows, wrists, and areas usually covered by clothing like the shoulder blades, groin, breasts, beltline, and buttocks. Skin covered by jewelry such as watches, bracelets, or rings is also frequently affected. In young children and infants, itching and rash may extend to the head, face, neck, palms, and soles of the feet, often presenting as redder rashes or larger blisters. However, these symptoms are less common in adults and older children. Causes and risk factors of scabies. Scabies is contagious, and it's usually spread by having direct, prolonged skin-to-skin contact with an affected person. The exposure generally has to be sustained. A handshake or hug typically doesn't spread the mites, but holding hands for 5 or 10 minutes can. In adults, scabies is often spread through sexual encounters, and it's easily spread within households. While the mites live for 1 to 2 months on human skin, they can survive for up to 4 days on inanimate objects such as bed sheets, clothing, and towels. Less commonly, scabies can occur through contact with an infested item. This kind of indirect infection more frequently occurs in people who have crusted scabies. Scabies are not spread to people from pets. Pets can become infested with animal mites, and these can be passed along to humans. But animal mites can't reproduce on a person, and even if they get under a person's skin, they'll die within a couple of days. It's important to treat your pets, though, if they acquire mites. Getting scabies from swimming in a pool is extremely unlikely. In most cases of scabies, excluding crusted scabies, an infected person has only 10 to 15 mites on their body, and the chances that a mite would emerge from beneath wet skin are very low. Still, although it is uncommon, you could contract scabies by sharing a towel with an infected person. How is scabies diagnosed? If you suspect you have scabies, you must get checked out by a healthcare provider in order to treat the condition properly and avoid spreading it. A doctor will perform a visual exam to look for the scabies rash on your body and for burrows. Reactions to certain drugs can mimic a scabies rash, and other conditions can produce skin reactions that look similar. To be sure it's scabies, your doctor may want to confirm the presence of a mite, its eggs, or its fecal matter. This can be done by taking a scraping of skin to examine under a microscope, or by using a needle to extract a mite from its burrow. Duration of scabies. Scabies subsides once the mites have been killed. Once treatment starts, this typically takes a week. After treatment, even if all the mites have been eradicated, you may have residual itching for up to a few weeks. If the itching lasts more than 2 to 4 weeks, or if you notice new burrows or the pimple-like scabies rash, you might need retreatment. Complications of scabies. A scabies infestation can lead to complications when secondary infections develop. The non-stop scratching can result in open sores that can get infected with bacteria, often staph or sometimes strep, causing another skin infection called impetigo. While impetigo usually isn't dangerous, if it's not controlled with antibiotics, it can lead to serious complications. If bacteria enter the bloodstream, it can result in life-threatening sepsis. Inflammation of the kidneys can also be caused by the same bacteria as impetigo. How is scabies treated? Scabies treatment usually entails complete elimination of the infestation with the help of prescribed ointments, medicines, creams, or lotions. The patients are usually instructed to apply the prescribed medicines at night, as the mites are most active at nighttime. Once the mites attack the skin, any area of it, the medicines need to be applied to the whole body from neck to toe. It can be washed off in the morning. The treatment is required to be repeated after 7 days. The ways of applying medicine must be consulted by the doctor. Scabies can be treated with several medications, including permethrin cream, lindane lotion, ivermectin, crotamitin cream, benzyl benzoate lotion, and sculpture ointment. Permethrin cream is a topical medication that kills the scabies mite and its eggs, making it safe for use in pregnant women, adults, and children over 2 months old. Lindane lotion is typically prescribed for adults, but it's not recommended for children under 10 years old due to safety concerns. Ivermectin is an oral medication that is often used for people with compromised immune systems, but it may not be suitable for pregnant women or children who weigh less than 15 kilograms. Crotameton cream and benzyl benzoate lotion can also be used to treat scabies, but they may take longer to work compared to other medications. Sulfur ointment has been used for centuries to treat scabies, but its effectiveness varies, and it's important to consult a doctor before using any of these treatments. It's always best to consult a medical professional for proper diagnosis and treatment. Is scabies contagious? Scabies is a highly contagious disease, and it spreads like a wildfire through close physical contact. The mites spread from person to person who is in close skin contact. Mites burrow in the top layer of the skin and lay eggs. When the eggs hatch, they transfer up onto the surface of the skin and then spread among those in contact. Prolonged contacts only allow scabies to spread. Brief contact shaking head does not spread scabies until and unless the shake is for several minutes. People who are majorly at risk are the ones who live in the same house as the infected person,